Today we are going to break down two trauma-related childhood disorders that can appear on the ASWB exam: Reactive Attachment Disorder and Disinhibited Social Engagement Disorder. These disorders both come from early neglect, but they look very different in behavior, and the exam often tests whether you can tell them apart. Reactive attachment disorder happens when a child does not form a healthy emotional bond with caregivers because of severe neglect, abuse, or frequent caregiver changes early in life. These children often seem emotionally withdrawn. They may avoid comfort, resist closeness, and show little emotional response to others. On the exam, you might see a scenario where a child does not seek help when hurt, does not respond to comfort, and seems detached from caregivers. The key idea to remember is emotional withdrawal and difficulty forming attachments. Disinhibited social engagement disorder also comes from early neglect, but instead of withdrawal, these children are overly friendly with strangers. They may approach unfamiliar adults, show no fear of strangers, or leave with someone they do not know. On the exam, you may see a scenario where a child is overly trusting, seeks attention from unfamiliar adults, or does not check back with their caregiver in new environments. The key idea here is lack of boundaries with strangers and overly familiar behavior. Both disorders are linked to early neglect, especially in situations like institutional care, multiple foster placements, or severe caregiver inconsistency. The ASWB exam often tests your ability to recognize the child's behavior pattern and connect it back to early attachment disruption. A simple way to remember the difference is that reactive attachment disorder is emotionally shut down and withdrawn, while disinhibited social engagement disorder is overly social and has no stranger boundaries. On the ASWB exam, you are often expected to recognize symptoms, understand the role of early trauma, and identify appropriate interventions such as stable caregiving environments, trauma-informed care, and attachment-focused therapy approaches. If you want to get stronger at breaking down scenario questions like this, our prep program at Social Work Exam Strategies teaches you how to identify key clues in the question, eliminate distractors, and choose the best answer with confidence using our signature strategies.